So Emily, Liz, and I decided to present on tinnitus. And so derived from the Latin term tinere, meaning tinkle or to ring, tinnitus is defined as hearing noises or ringing in the ears. Tinnitus involves hearing phantom noises, which are defined as involving the sensation of hearing sound, but sound not actually being present. So I think Dr. Eppinga actually talked about this in class. You can't hear, there's no external sounds, but you can still hear ringing inside your head. So rather than being the result of an underlying condition, tinnitus is actually only the symptom of those conditions, which can be like age-related hearing loss or ear injury, stuff like that. So as mentioned before, tinnitus results in phantom noises, which are internal, not external. These can include ringing, cracking, buzzing, and these phantom noises range in sound intensity and can vary in which ear they're found in, or if they're found in both. It varies for everybody. So when a doctor assesses an individual for tinnitus, they'll perform a series of tests to determine whether or not they actually have it. So the first test that they might do is the pure tone audiogram, and that one they put you in a room and they give you headphones and they play sounds at different frequencies, and then you tell them when you can hear it, and so when you can't, that just determines your hearing limits. The second one might be an acoustic reflex test. So they determine the contraction of the middle ear muscle and when it responds to noise. So it's much like when a doctor hits your knee and seeing when your reflex contracts, it's the same in your ear. So once the doctor's tested for tinnitus, they try to figure out the level at which the external noise becomes painful or uncomfortable to see how bad your tinnitus is. So in many cases, an exact cause is actually not found, but we do know that tinnitus can be caused by damage to the inner ear cell hairs, and it can also be contributed by age, noise exposure, earwax, stress, and I actually went to the nurse today to check on my own ear infections issues, and she told me that antihistamines can actually cause tinnitus, which seems a little strange, but yeah. So diagnosis, as we said, they can do hearing exams, and we won't go in that, I already explained it, but then you can also do range of motion to see if there's pain in different range of motions, and CTs and MRIs may be requested, and the sounds that the doctor can hear with the tests helps to identify the possible causes. So if you hear a clicking sound, it may be caused by muscle contractions in the ear, and low-pitched ringing may be caused by Meniere's disease, which causes vertigo. So treatments, as with any disease, the treatments depends on the severity of the disease. For tinnitus, there's not really much that you can do, but there are two categories for treatments. So there are underlying conditions, which I said would be age-related hearing loss. So you could do earwax removal, surgery for vascular diseases, and medications. Are yours working, or are they making it worse? As I said, antihistamines can cause tinnitus. Noise suppression treatments would be devices hearing aids to make your external sounds louder to try to drown out the internal noises, or white noise machines for calming noises to kind of take away the discomfort. So the prognosis, tinnitus, it's not really curable, but it's not life-threatening either. It's more just bothersome because it's annoying to hear ringing in your ears all the time. So since it's not threatening, but it does worsen with age, treatment is good, and medications and treatments do help. And since it's a symptom of a separate condition, follow-up for each patient is different. Two management procedures that may help include counseling, which helps you to manage it and to deal with it because it can be a disturbing disorder, or support groups to help you share your experiences with others living with tinnitus. So yeah, that's tinnitus. Here's our citations.